Hi, my name is Carrie Aborn, and I'm the Director of the Center for Career Development here at Curry College. We are starting our info session with the Boston University School of Public Health, talking about our Select Scholars program. And we have with us today a few special guests. Before I introduce our main speaker, I do want to just call out Professor Weinstein. Thank you for being here with us. Professor in our Community Health and Wellness and Public Health and Wellness majors. Do you want to say hello?
Hi everyone, I'm Dr. Weinstein, and again, one of the professors in the Health and Wellness program, and really happy to be here and to act as a liaison between our program and the BU Public Health program.
Thank you. And we have a special alum with us today, Shea Matthews, who graduated earlier this year and is now a student at Boston University.
Hi, I'm Shea. I graduated Curry with my Bachelor's of Science in Community Health and Wellness, and now I'm at the School of Public Health at Boston University for my Master's in Public Health with my Functional Certificate in Global Health Program Design, Monitoring, and Evaluation, and my Context Certificate in Maternal and Child Health.
Wonderful, thank you. So students will be able to ask you questions later on in the session, Shea. So thanks again for being with us today. And our main speaker is Angela Coletta Acevedo, and she is the Assistant Director of Admissions at the Boston University School of Public Health. So Angela, thank you so much for being with us today. You helped us spearhead the Select Scholars program, which we're really excited about hearing more about today.
Thank you so much, Carrie, and to your team. This has kind of been a long time coming, so I'm really, really excited to be here with you all today. In any normal situation, I'd probably be on your campus, or you would be coming to BU to actually check out our campus. So these are kind of extraordinary times. I'm really happy that a lot of you are thinking about public health. We need more public health practitioners. And I'm really, really excited that you all are thinking about BU in particular. We have this really amazing partnership now with Curry that I'll get into during the presentation. My background is not in public health. I've been in higher education for the last 12 years. I'm really here to help support you on your journey to graduate education and to BU. So anything I can do to support you through the application process, provide resources, information, connect you to students, connect you to faculty, that's my job. So let me know. And we'll get into the agenda. Perfect, okay. So everyone can see my screen, right? Awesome. So yeah, so we'll talk a little bit of just generally about why Boston University. We'll talk a little bit about the Select Scholars program, for which Shea is a current Select Scholar. We'll talk about our overall degree programs. I'll get into the admissions process, and we'll also talk about one of the most important pieces, financing your education. And then there'll be plenty of time for questions at the end. So let's see, here we go. Awesome, so why Boston University? Our values drive what we do and how we do it. We're committed to igniting positive change in the world. And we seek to create a respectful, collaborative, diverse, and inclusive community within the School of Public Health, and to promote justice, human rights, and equity within and across our local and global communities. Public health is about solving problems, right? Hopefully that's why you all are thinking about going into public health. We're engaged in a bold pursuit of solution to those problems that disproportionately affect the underserved and the vulnerable. We do all of our work through education, research, and service, or as our motto states, think, teach, do, for the health of all. So more on why Boston University. We're ranked the #8 school of public health in the country by US News and World Report. And this ranking really speaks to the amazing work of our faculty, staff, and our students, everything that they're doing to advance research and practice in public health. This ranking also has a lot to do with our dean, Dr. Sandro Galea. Dr. Galea is a world-renowned epidemiologist and doctor. And I would say he's elevated the conversation about population health and social determinants of health. And I would highly recommend looking into Dr. Galea's work and research if you have the time. Location, obviously we know everybody's in Boston, or I don't know if everybody's from Boston, but you all are in Curry, going to Curry, so you know about the Boston area. You know, our location is one of our biggest strengths, right, for public health. We're located right on the BU Medical Campus in the south end of Boston. So we're intimately connected to the BU Medical and Dental schools. So a lot of you might be familiar with sort of the Fenway campus over on Comm Ave. We are right by Boston Medical Center. So again, that's another huge resource right next door to us, literally, which is, you know, one of the largest safety net hospitals in the country. Also right next door to us, or actually right behind us, is a Methadone Clinic. We have a state-run mental health facility right next door. We have the state's infectious disease lab right behind us, healthcare for the homeless, countless nonprofits and governmental agencies literally right on our block. So lots to get involved in from a research and a practice-based perspective, right in our little neighborhood. And if research is something you're interested in, that's one of our biggest strengths as well. If you're looking to get involved with research at BU SPH or with BU in general, you'll have the opportunity to do so. And some of our programs are designed to give you that hands-on research experience. BU as a whole has a $600 million grant portfolio, and SPH makes up about 10% of that. So our faculty oversee about $60 million in funding through various sources. So again, plenty for you to get involved in if you're thinking that you want to get into some research. I would also highly recommend, if you are interested in a specific area within research, going to our main page and clicking on the full menu button and typing in, you know, let's say if you're interested in sex education. Type that into our search function and you'll see the different faculty that are working on those types of projects, any projects that are happening at the school related to sex education or whatever you're interested in. It's a really great resource, and I would definitely say to use that when you're formulating your personal statement. You kind of want to do your research on, you know, whatever school you're thinking about applying to for grad school and be really specific. Grad student life is also a really amazing resource that we have within BU SPH. Grad student life provides the programming and services that support and enhance your experience and your success. So we have 13 student groups on campus right now, including Queer Alliance, Students of Color in Public Health, Student Senate. We have a part-time student organization and a few more. So anything on the main BU campus, you will have access to as well. So if you want to get involved with choir or any religious affiliated student organizations, anything that the Fenway campus has, you can also get involved with as well. So again, there's lots going on in terms of student programming. We also just hired a wellness coordinator for our school specifically at the School of Public Health. Her name's Alana. She's really amazing. She manages all of our social emotional wellness programming for students, faculty, and staff. So she puts together different yoga, meditation sessions, sustainability sessions and resources. She also does really fun things like game nights for students, faculty, and staff. So she does a lot of community building. So again, there's a lot of resources and programming for you to get involved in. We also have a really robust career and practicum office. They'll help you understand the public health job market. They'll help you basically learn how to market yourself, help you build your network, help you find a practicum that potentially addresses gaps in your resume and or your work experience. So you'll have a dedicated staff member based on your academic program who will advise you every step of the way. And the services within the Career and Practicum office are lifelong. So even after you leave BU SPH, you'll still have support and career coaching, which is a really great resource. And us compared to other schools of public health, we have one of the largest staff of any school of public health within our Career and Practicum office. So we have a staff of about 10. So again, a lot of resources, a lot of coaching, a lot of support to help you get to where you want to get to in your career We also have a really amazing alumni network. That's one of our biggest strengths as well. We have nearly 10,000 alumni from around the world, over 115 countries. The alumni office can help connect you with alumni in various areas of public health practice and within the workforce that you might be interested in. So again, another really great resource. So let's talk a little about the Select Scholars Program. Let me just move this. Let's see if that helps. Perfect. So that's what I'm here today to talk to you about. The Select Scholars Program seeks to educate and provide opportunities that prepare students like you to contribute to a healthier global society. So you're in good company in this program within Curry. Select Scholar Schools are leading undergraduate liberal arts colleges and universities, and we have 17 different partner schools from across the country, including historically Black colleges and universities and historically Hispanic serving institutions. So let's talk a little bit about the benefits of the program. So new for this year, we've added an early notification acceptance for students. So if you're one of those go-getters that knows right now that you want to apply in your senior year, you can apply now. The application has been open since August 18th, but we will provide this early notification decision for you until October 15th. So what that means is we're going to try and turn around a decision to you as quickly as possible. If you decide that you don't not really sure if you want to apply right now, you can wait. Obviously, you can apply after October 15th. Your application will be reviewed like everybody else's. So there won't be any sort of expedited decision if you apply after October 15th. So if you think you know right now, like, I want to apply to BU. If you can get your application in before the 15th of October, we will turn around a decision to you as quickly as possible. And our application will be open until June 1 of 2021. So again, if you're kind of the opposite of sort of the early bird, if you're sort of like a late bird and you're like, you know what, in March or April, I think I do want to go to grad school come this fall, our application will be open until June. So no pressure. The biggest benefit of the Select Scholars Program is you're guaranteed a 35% scholarship. So that's quite a large percentage comparative to other schools of public health. And again, if you start the program part-time, you'll have that 35% no matter how long you stay in the program or how long it takes to finish your program. Our master's programs take about 5 years to finish. So again, this 35% will stay with you even if it takes you 5 years to finish the program. We also provide transportation for our accepted Select Scholars to participate in one of our Spring Accepted Students Days. For you guys, again, because you're mostly in the Boston area, we pay for your transportation to get to our campus. And then if you'd like, we'd put you up in a hotel right down the street from our campus. So usually our Accepted Students Day for our Select Scholars weekend, you all will come to the campus on a Thursday, and there'll be a welcome reception. Friday, we'll do a day of community service with one of our area nonprofits. And then Saturday, you'll meet with all the heads of the different academic programs, as well as the heads of all the offices, career services, grad student life. So again, not as big as a quote unquote benefit as, comparative if we have a school kind of across the country. But for you guys, again, we pay for your transportation if you wanted to jump in a Lyft and come to visit us, or if you have your own car, we pay for your mileage to come and visit us. And then we also have a series of webinars coming up this fall that just will help provide guidance for you as you're thinking about going into public health and as you're thinking about graduate school. We're going to have a financial aid webinar in December. And we also will probably have a housing webinar come in early spring. So you all will have exclusive access to those series of webinars. And also new for this year, you will have access to a dedicated faculty mentor that's just specific to the Select Scholars Program. Once you matriculate to the program, to BU SPH, you'll have a faculty member as your advisor anyways, but you'll also have a specific faculty member that's just for you as a Select Scholar. So an extra advisor. And usually your academic advisor, once you matriculate, they're more related to kind of whatever academic, obviously whatever academic program that you're interested in. Select Scholar faculty mentor will just be somebody sort of broad that might not necessarily be tied to your academic program. Does anybody have any questions about any of that? I can stop too.
I have a question. Are some of these benefits newer? Like I don't remember hearing about the mentor before. That is so exciting.
That is new, yeah. That is new. We just figured, you know, additional supports for you all, you know, is better than less supports. I mean, you do get a lot of support in terms of faculty mentorship, but it's just an extra kind of outlet, I would say, to have on campus.
Can I ask a question? Can you hear me?
Yeah.
Are the GREs waived?
Yes, yeah. So in years past, when we first started the Select Scholars Program, we were waiving the GRE for students, but now we've actually dropped the GRE as a campus.
I love that.
It's not a good indicator for student success.
Yes, I agree.
And it's biased. So that's part of the reason why we just thought, you know what, we got to get rid of it. Select Scholars, it was already, you all already didn't have to submit the GRE, but we just figured, you know, let's try this pilot program. We're in our second year of the pilot program of dropping the GRE.
I fully support that.
I think that's going to honestly be the wave. There's a lot of conversation within our professional development organization, ASPPH. A lot of other schools are thinking about dropping the GRE as well. So these are all of our programs. This just kind of shows you the depth and the breadth of what we have at BU SPH. Can everybody see that? Might be a little squished. So we have the Master of Public Health, which is one of our largest programs, most popular, I would say. Master of Science programs as well. We have dual degrees with other schools within Boston University. So if you're interested in that, let me know. For the Select Scholars Program, though, you would only get the 35% off for the Master of Public Health and for the Master of Science. We would not cover dual degrees. But let me know if you are interested in a dual degree, and we can chat about that. We have several PhD programs as well. I'm the liaison for environmental health and epidemiology. And we also have a grad certificate in public health, which is just the core classes of our MPH, which I'll talk about right now.
Angela, for the Mph Dual Degrees, can you just say what each of them are? Because not everyone might be familiar with those acronyms.
Yeah, sure. So we have a MBA, MPH, which is a Master of Business Administration. So you'd have to apply separately to Questrom, our School of Business, and apply to us, and then get into both programs in order to be a dual degree student. We also have a JD, which is a Juris Doctorate. So that's a law degree. And if you wanted to do your MPH, focusing on, a lot of students do health policy. So that's available for you. We also have an MS degree program. It's a Master of Science in Graduate Medical Sciences. So that really helps students prepare for entry into medical school. So students who weren't maybe as strong academically to get right into medical school, a lot of students now are doing these MS programs to prep them. It's a two-year-long program at BU to prep you for medical school. So a lot of students do the year of coursework, and then they do a year with us for the MPH. So it's a little confusing because we also have Master of Science programs, but that's the MS, MPH. And we also have a medical doctorate, your MD, if you're thinking of going on to medical school. Most students apply first to these schools and then apply to us. That's usually just how it works out, because students usually start over, let's say, at the medical school, and then they come over to us. And we also, one really popular program is our Master of Social Work with our MPH degree. Again, you're getting 2 separate degrees. The Master of Social Work, that's about 100 credits right now. It'll take 3 years to complete that in full-time work. But that's probably our most popular dual degree. So yeah, so the Master of Public Health, like I said, this is our largest degree program. This incoming fall, we actually had 370 incoming MPH students. So this is one of our largest years in the history of the school. Last year we had like 250, maybe a little bit less than that, just kind of depends on the year. So our Master of Public Health is 48 credits, and it can be done full-time in a minimum of 16 months. A lot of students ask, can I get it done in a year? Need at least 3 semesters with this MPH. Part-time options are available. We do have students who work full-time and do the program part-time. Like Shea, you work full-time, right?
Yes, I work full-time and I'm doing the school full-time also. So it's a lot, but with certain time management skills, you can do it. It's a lot though.
That's right. I forgot. Yeah, you're doing the program still full-time. But if Shea was like, you know what, this is too much, I'm going to go down to part-time next semester, you have that flexibility. You can literally go back and forth between full-time and part-time. What sets us apart from other schools of public health, we have no work experience or prior coursework required. So if you're looking at schools like Johns Hopkins, I think George Washington too, GW, they make you have some prior work experience before you apply, but we do not.
Angela, we're always telling students that, you can go on to public health from any major. Can you just speak to the types of majors that you see, coming through your program?
So literally the other day, I have to go through everybody's final transcripts to make sure that they finished undergrad and they can actually start with us. The other day I was looking, somebody finished up with a bachelor's degree in like architecture. Because we have, basically if you have a liberal arts degree, if you're thinking you have a sociology degree or a psychology degree, literally anything. We have a student too who her degree in undergrad, her first degree was in music. So we have some people who are kind of later in life too coming back and saying, you know what, I'm really interested in this within public health. So it really just depends on you. The only thing is, if you do have some statistics classes, I would say most liberal arts majors have some sort of statistics class. The faculty will probably be looking at that a little bit more heavy because you don't really have those math and science courses. That's the only thing. And we have no GRE to say, okay, they did really well in the math portion. So if you're thinking, you kind of want to stack, if you are a liberal arts major and maybe, you don't have a lot of math and science courses, maybe in this semester, or, well, no, I guess it's too late in this semester, maybe in next semester, adding some math and science classes to kind of just prep you. But we have some, so this is the integrated core. This is the first semester of the Master of Public Health. So these are just before classes, 4 credits each. This is what you'll start off with before you jump into your area of specialization within the Master of Public Health. The only concern faculty usually have is about this quant methods class in public health. It's very, math-based, very, statistics heavy, obviously. I don't know, Shea, if you can talk a little bit. I don't know if you've had any experience so far with quant methods.
Yes, I have. I am taking quantitative methods right now. It's good because you do a lot of practice problems throughout the week and stuff. So they keep you going and they move at a pace that the rest of the student body is moving at. So everybody's together and they check in every week, and you can talk to your professor has office hours, and then there's like 3 or 4 TAs that we have in our class, and they all have separate office hours. So if you can't meet with one person, there's always another person that you can meet with. And our TA for that class actually is available on Saturdays, which is super helpful because usually there's not a ton going on Saturdays. So you can meet with her then. But it's definitely highly math-based, and learning how to use R right now, which has been fun. But it's a good class, and I like how they're pacing it really well to go at everybody's speed.
That's great. Yeah, I think if you're coming from a background where you don't have a lot of math or science, this is the class that the faculty are going to be worried about you getting through, if I'm keeping it 100% real. So, if you're in your sophomore, junior year, if you want to add, a statistics class to your schedule at some point before senior year, before you actually apply, that would be really good for you.
Angela, why is math so important to the field of public health?
Well, I mean, there's a lot of research, I guess it depends on what area you want to go into. Like if you're going to be a hard science person and I'll get a little closer. If you're going to do, let's say like epi and biostats or environmental health, it's going to be a lot more math focused. Whereas if you're going to do like community assessment program design or global health or health policy and law, it's probably not going to be as math-based. So it depends on kind of what area within public health you're going to go into. Same with health communication and promotion. We have a lot of marketing students who are really just interested in, how do we communicate better about this issue within health? Not necessarily using math, but it depends. And the faculty definitely, if you're going to apply for epi and biostats, that certificate, they are going to look a little bit harder at what you took in undergrad. Because they want to make sure that you can potentially get through that program. So these functional and context certificates, you almost want to look at the functionals right there to the left as like your major, and context like your minor. In undergrad, you have to choose a major, right? It's the same with us. You have to choose a functional certificate. You don't necessarily have to choose a context certificate. These functional certificates are all 16 credits with the exception of healthcare management. That is 26 credits. A lot of students will choose one functional and then one context. Contexts are like, a framework or a population that you'd like to work with, that you'd like to add to your repertoire, essentially. We tried to design this program. I didn't personally design it, the faculty and the deans. This is all within the last, I would say, 5 to 10 years that we've had this structure of the MPH, but we've tried to make it as flexible as possible so that you all can choose and really dig in deep to the areas that you're interested in. And we give you the opportunity to be as flexible as possible. So if you want, you have to choose a functional. So let's say you want to be, environmental health, you want to do environmental health. You can cherry pick courses that basically fill up to 48 credits. So if you're like, I know I want to do environmental health, but I'm really interested in sex, sexuality, and gender. I want to take a course in that. There's no problem, you can take a course in that. You don't necessarily have to have that context certificate. If you just want to kind of cherry pick and get a little bit of each area, you have that opportunity to do so. You can also choose up to 2 functional certificates. I thought I mentioned that. And Shea, what is your global, right, for your functional?
Yeah, my functional certificate is Global Health Program Design, Monitoring, and Evaluation.
And did you choose a context or no?
Yeah, my context certificate is Maternal and Child Health.
Maternal and child health, okay. Yeah, that's kind of a common pairing, I would say. So yeah, this can be a little confusing to some students. And again, if you have any questions about that, be happy to walk through it again.
Shea, what was your process in like reviewing all the functional areas and context areas, and then coming to the decision to choose the one that you did?
So how I decided was because I was supposed to have my accepted students day, but it got canceled due to COVID. So I kind of utilized the online resources that we had on the BU website, the BU School of Public Health website. And on there, there's descriptions of each of the different functional and context area certificates. And I just read them and analyzed the things that I like and the things that each one of those offered. And for me, I always knew that global health was what I wanted to do. So my functional certificate was a more obvious choice for me. Or my functional certificate was an obvious choice for me, but then the context area, there was a few that I was interested in, and through reading that and through other experiences, I realized that the maternal and child functional or context certificate was the one I definitely wanted to go for.
And you can apply, you don't have to necessarily apply as anything. You can apply as undecided, and then within your first semester, you would have to declare your functional. So you're not tied to anything. We also have students that will apply, let's say, to Mph and Biostats. Then they get here first semester, they're like, oh, I don't want to do this at all. I really want to do like program management or healthcare management, and you can switch it. So you're not tied to anything at the application. And I would say if you are, you're really not sure, just apply as undecided. But we do on our website, and I'll get into this in another slide, but we do have all of these options in Sophist for you to choose. So it can be a lot, and it can be kind of confusing. Awesome. So let's talk about the practicum. Shea's not close to the practicum yet. She's got to get through this semester, but hold on. So you are required to do 240 hours of a practicum of your choice. The practicum will provide you with that hands-on experience that aims to address gaps in your experiences in the field of public health. So you have a lot of flexibility in terms of options for where you do your practicum. You can do it locally, you can do it across the US. If there's an organization that you're really interested in, that you want to kind of get your foot in the door, I would definitely say to do that via the practicum. Or you can do it globally. I'd say about 1/3 of our students do their practicum somewhere outside of the United States. After you complete the core classes, you can do your practicum. So most full-time students do their practicum in the summer after their second semester. Part-time students, you can break up the practicum however you want, literally, just to make sure and ensure that it fits your schedule. So you can literally do like 4 hours a week for 60 weeks. It just depends on your schedule and what you've sort of worked out with your boss or whatever sort of personal situations you have going on. Career prep is also a really great tool for you to use. It provides you with techniques and competence to effectively market yourself during the job search process and throughout your public health career. So it's a program that's taught by experienced career service professionals and will help you build your public health network of employers, alumni, and experts from the field. ILE is also a huge piece of the MPH. It's your integrative learning experience. It's almost like your capstone or your culminating project. The ILE is tied to your required functional certificate and will incorporate skills and content from the context as appropriate. So if you choose to do a context, you can take different elements and utilize them in the ILE. You'll only complete one ILE regardless of the number of certificates that you pursue. So if you're working to complete 2 functional certificates, you'll meet with your faculty advisors and career services staff to determine which ILE option is the best for your career interests. The ILE is required. It's a 0 credit component of the MPH. It's student initiated and faculty guided. So you'll essentially have a faculty committee helping you with your ILE. So you'll have at least 2 or 3 faculty members helping you with the ILE. And your peers will also be helping you with your ILE, depending on which functional certificate you have. So you'll register for your ILE in your last semester of the program. And I should mention too, all of the elements here that you see, the practicum, career prep, and the ILE, they're 0 credits. So you don't have to pay for them, and there's no fees tied to any of these. Other schools of public health, sometimes they charge students to do their practicum. We do not. Actually, Shea, do you know yet where you might want to do your practicum?
I'm hoping to be able to do my practicum abroad. I was talking to a few School of Public Health students, and a lot of them did different, completely different types of practicums, but they were, I talked to 2 different students who did them in Africa. And so those are really interesting to me. I don't, because it feels like it's still kind of far away. I don't have a real set plan, but I'm hoping to do it abroad.
Great. Yeah, you still have a little bit of time to figure it out. We also, again, as a select scholar student, you'll get 35% off our Master of Science programs. So within the field, I would say, of public health, a lot of students know about the MPH. We also have these really amazing Master of Science programs that are much shorter, and they're much cheaper than our Master of Public Health. Our Master of Public Health is 48 credits. Our Master of Science programs are only 34 credits. You can start our MS programs in the summer, and then by next May, you're done. Our Msn Applied Biostats is a really amazing program. Within the program, you'll learn how to gather and analyze data, design research studies on health outcomes. This is the only program within our school that requires some sort of prerequisites. So the faculty on the admissions committee like to see that you've done college level calculus, including multivariable calculus, and 1 formal course of linear algebra. But again, no specific undergraduate major is required. And what's really unique too is you'll do a 100-hour research rotation and a 400-hour internship or practical training in your last semester. But literally for most of these students, this practical training leads directly into a job. And especially within biostats, we need more biostatisticians. So if this is something, if you've had a lot of work experience in a particular area and you're thinking, I really want to kind of brush up more on my research skills, our MS in Applied Biostats or our MS in Population Health Research really would be a great option for you. Our MS in Population Health Research, it's kind of new. This is kind of our first full year of the program. We have different specializations: climate and health, epidemiology, global health, translation and implementation science, public health data science, and you can do a custom program, taking different elements from the different specializations to kind of fit it to however you want. For our MS in Applied Biostats and our MS in Population Health Research, students come together and everybody does this sort of these core classes on quantitative and qualitative methods in public health. And then everybody breaks out into their area of specialization. They either take the core classes within Applied Biostats or the core classes within the specializations of the Population Health Research degree. So within the MS and PHR, you'll develop a scientific hypothesis as sort of your capstone or final project and design a research study to test the hypothesis. Again, you can complete these degrees in a year of full-time coursework, or most students do it in about 2 years. But again, you have up to 5 years to finish these degrees. This is our admissions process as well. So part of the Select Scholars program, we need to get a sign off or an approval form from either Dr. Weinstein or another faculty advisor, or even Carrie. If you wanted to sign off on students, you can. Just basically stating that the student is in good academic standing and they have at least a 3.2 GPA. So you as a student will sign off on it, and your advisor will also sign off on it. So you can submit that electronically to me, and then I upload it to your SOFIS application. So your SOFIS application. SOFIS is a third-party application site. We don't own our application at all. Most schools of public health use SOFIS. I've heard mixed reviews on it. I don't know, Shea, if you had any difficulty with it as an applicant.
I thought it worked really, really similarly to the Common App. It was pretty easy and straightforward for me, at least.
Perfect.
I used it way back in the day for all of the schools I applied to.
Good. That's great.
And it was great, yeah.
Yeah, usually, so what you would do is basically upload everything, and then you'll designate different schools that you want to apply to. The only thing is, you know, don't send us, if you're thinking that you want to apply to like Tufts or something, don't send us Tufts, you know, the personal statement that you wrote for Tufts. It's different than like medical school. Everybody writes the same, you know, letter, personal statement, and sends them out to all the medical schools. We want you to be really as specific as possible with the personal statement. And like I said, there's, we have this really amazing, I don't know if everybody can see it, but this full menu button, you click on that, here's a search function that we have here. So anything that you're interested in, type that in there, and then you'll see the different faculty and or announcements that come up related to sex education. Or literally anything. You can type in, you know, cancer epidemiology or global health, and you'll see the different projects that students are getting involved in and faculty are getting involved in. So you want to be really specific in your personal statement. You know, why BU, what faculty you want to work with. And again, if you're going to apply to Tufts, or you're going to apply to other schools, Northeastern, do your research on Northeastern and Tufts as well. Getting back to the admissions process, so yeah, you have to submit the application through SOFIS. We have what's called a supplemental application. It's just literally a question that asks if you've ever applied to BU before. It literally should take 2 seconds. Let me know if you have any troubles with that though, because sometimes that's one of our homegrown pieces that we've added to SOFIS. So sometimes there can be some blips with that. Transcripts also can take a bit of time. You have to send those into SOFIS, and then SOFIS verifies your transcripts. So they go grade by grade, course by course. Whatever you input into SOFIS, they double check to make sure that whatever you put in is correct and that your application has basically been verified and your transcripts have been verified. So sometimes that process can take 2 to 4 weeks. So that can be one of the longest pieces. Like I said, your personal statement, be specific, why BU, why BU SPH, and kind of what you're gonna do with the degree. 3 letters of recommendation, we ask that, you know, if it's possible, 2 out of the 3 be from faculty members. If that's not possible, that's totally fine. You know, if there's people that you've worked with or you've done volunteer opportunities with that can kind of speak to you and your work ethic and who you are, that would be great. And also your resume or CV if you have one. And funding, this is kind of one of the most important pieces, right? As a select scholar, like I said, you're guaranteed to get 35% for the entirety of the program. There are other forms of aid. If you're a domestic student, there's student loans that you can apply for. You know, and unlike undergrad, you know, potentially if your parents or your guardians they're not factored into your expected family contribution. So you can keep that in mind when you're thinking about loans. So you might get more favorable loan terms and repayment options if you're kind of fresh out of college and not making a lot of money. There's also student employment, research assistantships, fellowships, teaching assistantship opportunities. These are usually department specific, and we have 6 different departments within the School of Public Health. So all these opportunities are posted to our Handshake account. I know you guys have a Handshake account as well at Curry. So yeah, these opportunities are usually posted 6 to 8 weeks before the start of the semester. So it can be a little nerve-wracking because we get students who are asking us, who haven't even applied yet, asking about, you know, teaching assistantships and research assistantships, and they're definitely there, they're available, but you have to wait till you get a little bit closer to you actually matriculate. Does anybody have any questions about any of that? We do have a financial aid webinar coming up on December 10th that I'll send Carrie the link to, or I can share it with you all. I think I have all of your names too in your emails. I can share it with you as well. We'll have Tatiana Antoine. She's a current Mph student herself. She's our Assistant Director of Student Financial Services. So she gets a lot more in-depth about financial aid and housing as well too. So yeah, this is our contact information. Here's my email and my personal line down at the bottom there in gray. If there's any questions, you know, that come up, you know, tomorrow or next week, you know, shoot me an email or give me a call.
All right, well, thank you so much, Angela. We will open it up for questions.
Perfect.
You can unmute yourself if you want to ask a question. You can also put it in the chat. I'll start us off with a question to Shea. What has your transition been like from being an undergraduate student at Curry? I know you're 2 weeks in now to your master's program, but in general, what can you tell us about the transition and the differences between, you know, master's program and undergraduate program?
So my transition is probably different than what most other people's transition would have been, because I'm taking all my classes completely online this semester. And because I actually graduated in December last year instead of May, I didn't have to do any online classes at all at Curry. So the transition for me is really going from being all in person to being all online. It's definitely a little bit more of a self-driven journey. But what I've really loved is all of the resources that BU has been able to offer me. The orientation program was phenomenal. You just logged into different Zoom meetings and listened to different presentations and did some group work sometimes, and I got to meet some new friends that way, which was really cool. And it was a different way for me to meet friends than I ever have before. And I've learned too through my TAs and my professors that in each individual class, there's a lot of resources just within the class, as well as the different resources I can reach out to on the BU campus. So that's been a nice thing to learn. It was something I was nervous about learning, but BU definitely did an excellent job about making sure that we all had plenty of access to all of the information we were going to need before any of these classes started.
Thank you.
I also have a question for Shea. My question is more about like your personal reasons for picking BU as opposed to like another graduate school. Because I heard you talk about resources, like is that all?
So I looked at a few different schools. I ended up only applying to BU. I got into BU so early in comparison to what I would have gotten in, how early I would have gotten into any other schools. But because of the access BU has to all of the different areas in Boston, all of the different hospitals and the different organizations in the Boston area, not to mention because I was looking at global health, looking at all of the different practicum experiences people were able to have abroad, was really what pulled me to BU. And it was something I was really excited about. Plus, being in the Select Scholars program, there was a really cool orientation or accepted students day that you get to be a part of, as well as getting a nice scholarship as a part of that. And those were some things that I probably could have gotten some decent scholarships at other schools, but not as good as the one that they were able to offer me. So BU is just, it became the perfect choice for me, became the most obvious choice for me as well.
Thank you.
Great question. We are just about out of time, but we want to stay to make sure that everyone's questions are answered. Dr. Weinstein, do you have any thoughts to share, any questions of your own, or just general comments to the group?
I don't think that I have questions. I mean, I thought that was a great presentation of all of the information, and I just so commonly get students who are interested in asking and have questions, and I think it's really great for them to be able to see all of this laid out, and now for me to be able to say, okay, well, now I know who the contact is. So for students who are in this chat, I would just say, feel free to come to me if you want to talk about it further before you connect with someone at BU or before the application process. I'm happy to chat with you about all things public health and what it means to have a degree in public health. I have an MPH. Could probably put you in contact with students such as Shea if you want to talk to someone who's going through it a little bit further down in the process. So yeah, I think that learning more about what you want to do in public health and understanding what the Masters in Public Health, as well as the other programs, entail is going to be really important for you. And I think it's great that we have this partnership and that BU has so many different types of programs just in their School of Public Health and so many resources to your avail that, to me, if you know that you want a graduate degree in public health, it's kind of a no-brainer to do more research into this program because it's a really wonderful partnership for both of us. So just don't hesitate if you're a student sitting in this chat to reach out to me if you need kind of somebody to make that initial contact with and start to gather information before you move forward.
Thank you. Yes, I definitely recommend being in touch with Professor Weinstein if you are interested in this program. You can also make an appointment with the Center for Career Development. We can help you with some of your application materials. And I'm going to put in the chat the link to make an appointment. And we actually have our Assistant Director for Career Advising on the line. I didn't introduce her earlier, but best for last, Nicolene Batista is our Assistant Director for Career Advising, and she's the one that you'll meet with when you make an appointment with us, and she can help you, along with Dr. Weinstein, with all the documents that you have to pull together for the SOFIS application.
Yeah, and again, if somebody has any questions and you want to have a one-on-one call, I'm obviously always open and ready to help.
So Angela, do students ever, are they allowed to ask you to review their documents before they submit for any advice that you might have, or is that typically not something that people do?
Honestly, it's not typical, but I'd be willing to do it. I don't know if that's allowed, but honestly, I do. There has been a couple students that I've kind of coached through the process and said, you know what, maybe you want to be a little bit more specific on your personal statement.
Great. Well, we appreciate your willingness to do that. All right, this is a really great time to go into the field of public health because we're in the middle of a pandemic and we need our best and our brightest to be in this field right now to to help with this particular pandemic and anything else that might come up in the future, in addition to all the other serious public health issues that exist right now. I noticed that Shea put her email address in the chat. So Shea, thank you for doing that. Please take note of her email address if you want to reach out to her directly.
I might be emailing you, Shea.
I'm going to go ahead and end the recording of the session. So thank you very much to everyone for joining us. We will stick around for a few minutes if anyone has any direct questions that you want to ask.
Thank you all